Good afternoon, everyone. My name's Todd McLaughlin. I'm the Vice President of Sales for TheraFirm Compression, and I'm very fortunate this afternoon to be joined by Donna Kelly, who is a vascular technologist with a specialty in venous ultrasound. Donna practices at Middlesex Surgical Associates in Winchester, Massachusetts, and is part of the Lahey Health Group. So thanks for answering a few questions for us today, Donna.
Thank you for having me.
Absolutely. So can you tell everyone a little bit about what you do every day in your practice?
Sure. So I do vascular ultrasounds in a surgical private practice. For the last 15 years out of my 25-year career, I've focused specifically on venous disease. So I spend a lot of time doing ultrasound on patients that have problems with their veins, specifically venous insufficiency or varicose veins. Spend a lot of time with those patients, which I think is what we're here to talk about today.
Absolutely. So in that group of patients today, we'd kind of like to focus a little more on the moms, if we could. Sure. Can you tell me some of the common things that you see when moms come in to see you, when they come to see you, what symptoms they might be feeling to decide to come and see you? Sure.
So what we see, what's really common with the patients is we mostly see the patients after they've had babies, honestly. And a common theme with these patients is the more pregnancies they've had, the more babies they've had, the worse their veins are. And the one thing that we have to kind of keep in mind when we talk about veins is the veins, they get worse with the pregnancies, with each pregnancy, is because as somebody's pregnant, their hormones are allowing their veins to overstretch. And there's a reason for that, because they have to have added blood volume for the babies. So, their veins are overstretching, and with more pregnancies, they're stretching, and eventually the veins can't go back to their normal size. And this is why they by the time they're 2 or 3 pregnancies in, their veins just aren't able to rebound back to normal. So this is to the point where they say, okay, I'm ready to do something about this. So they come to see us. And the symptoms that they're typically complaining about are not only visual, which is what some people think. These people are actually suffering from achy, tired, heavy legs that have some swelling that go along with them.
Okay. And what can you and the physician do for them as a solution?
So there's lots of different options, and ultrasound is an important tool because what it's going to do is help us to determine which veins are involved. There's lots of different veins in our legs. Some of the veins we can see, and those are the varicose veins. More importantly, what we need to know is which veins are involved, and that's where the ultrasound comes in. I always talk about veins like they're trees. So the veins that we can actually see are the branches of the trees, and we know the branches aren't working just by looking at them. So my job as the ultrasound tech is to look at the trunks of the trees. Do the trunks work or not? And then which trunks are they? And then what we can do is once we know that, the doctors will look at that and look at the ultrasound and they say, okay, these are the veins that's involved. This type of vein we can treat one way. This type of vein we'll treat another way. And they put together a plan and they go ahead and treat them. Now, the beauty of all of this is in the last 10 to 12 years, the procedures have come such a long way that they're super non-invasive. They're much easier to be done. Most of them are done in an office setting versus a surgery setting. They're about an hour to an hour and a half procedure. Most of them are done without any anesthesia at all, typically a local, and patients are very happy with it. Very little downtime.
Okay. And what's the expectation for the patient after the treatment?
So usually, as far as recovery goes, it's about a 2-week process recovery-wise. And by recovery, I mean some limitations as far as heavy lifting goes. There really should be no limitations as far as movement goes. So, being a new mom that's very busy with children, there is no real, we don't want you laying down. That's the worst thing you could do. So you want to be up and moving. Life as usual is great. So a heavy lifting thing is one of the things that we want to avoid. We also want to avoid any kind of exercise that involves any abdominal work. So that's one of the things that, we kind of stress. Other than that, walking is great, moving is great, any kind of cardio is excellent. And that's one of the things that keep people from wanting to actually, do these surgeries, because they think they're going to be limited in their mobility, and they're really not. So it's not something that should keep you from investigating having these procedures done. One of the things that you do have to do, and you should have to do after these procedures, is compression. We suggest that you, and some require that you wear compression after the procedures for a little while to make sure that the veins heal nicely like they're supposed to. The recovery is pretty simple as far as how the veins look and how you feel. Within 2 weeks, your symptoms will pretty much be gone. They're tired, achy, and heavy. The legs feel much better. Visually, it takes a little bit longer. So you're looking at, usually we say, could take up to about 3 months to see the maximum results of these procedures. And then you can slowly start to work on some of the more cosmetic ends of it. But by 3 months, you'll see the maximum result, and then you can go from there as far as cleaning up whatever's left over.
Wow, that's great. How many patients do you guys say that you treat in a month? Is this a very much more frequent type of thing, or is it pretty rare?
No, it's pretty frequent. I mean, I could fill almost every day with varicose vein patients, I guess we could call them,
Wow.
And we could fill, we do our vein procedures on Fridays, and we could probably fill a whole day every Friday with vein procedures. It's very common, and it's not just women, it's men as well. But because of the hormone situations and the pregnancies, it's certainly more prevalent in women.
Okay. Well, thank you so much for talking to us today. We really appreciate your time. Thank you so much.
Oh, it was my pleasure. Thanks for having me.
We hope that you'll turn to TheraFirm to help you with all your compression questions and compression needs.